Welcome to the Deep Dive. Today we're tackling a really important topic for cat lovers. Feline Hypertrophic Cardiomyopathy, HCM for short.
Yes, it sounds complex, but basically it's the most common type of heart disease we see in cats.
And it involves the heart muscle, specifically the main pumping chamber, the left ventricle getting thicker. Wow.
Exactly. That thickening can cause a whole cascade of problems, so understanding it is pretty crucial whether you're a pet owner or heading into veterinary medicine.
Okay, let's unpack this. I was quite struck by the statistic that, maybe as many as 1 in 7 cats could develop HCM? That feels like a lot.
It really does, and it highlights something key about HCM. It's common, but often, hidden.
Hidden? You mean asymptomatic?
Precisely. Many cats have it for years without showing any outward signs. So knowing it's this prevalent means we need to be aware, be vigilant, think proactive rather than just reactive.
Got it. So our mission for this deep dive then is to really explore HCM. We want to look at the signs, how vets figure it out, and what the treatment options look like.
And we'll do our best to break down the vet speak, make it accessible. We've pulled together info from various veterinary sources to give a clear picture.
Great. Let's start with those clinical signs. You said many cats are asymptomatic, which is frankly a bit worrying. When signs do show up, what might owners see first?
Well, it can be really subtle initially. Maybe your cat just seems a bit off, less playful, maybe sleeping more.
Things that are easy to miss, especially in cats.
Exactly. They're masters at hiding illness. It's not always dramatic at the start.
Okay, so what about more obvious signs? Things that might make an owner think, something's not right here.
Breathing changes are a big one. You might notice faster breathing, tachypnea, or more effortful breathing, dyspnea.
And what's normal? For breathing rate?
A resting cat should typically take between 16 and 25 breaths per minute. So consistently higher than that, especially when they're just relaxing, is a red flag.
And in severe cases?
If it's really severe, you might see them struggling to breathe, maybe crouching low with their elbows out and neck stretched forward. It's a posture to try and get more air in.
That sounds awful to see. Is coughing a sign, like in dogs with heart problems?
Interestingly, no. Coughing is pretty uncommon in cats with heart failure. That's a key difference from dogs. Instead, you're looking more for that rapid breathing, maybe even open mouth breathing.
Why the open mouth breathing?
That usually points towards congestive heart failure, or CHF. It means fluid is building up either in the lungs themselves, pulmonary edema, or in the space around the lungs, pleural effusion.
Okay. Now, something else that sounds particularly frightening is this sudden limb paralysis.
ATE?
Yes, arterial thromboembolism. It's a devastating complication. What happens is blood clots can form inside the heart, often in the enlarged left atrium.
Because the blood flow is sluggish in that stretched chamber?
Sort of, yes. It creates conditions where clots can form more easily. Then a piece can break off and travel through the bloodstream.
And then it gets stuck. Often where the main artery, the aorta, splits to go down the hind legs, it blocks blood flow suddenly.
Leading to pain and paralysis in the back legs.
Exactly. Sudden, severe pain, weakness, or paralysis, most often in the hind limbs.
How would an owner know if that's happening, besides the obvious paralysis?
The affected legs often feel cold. The paw pads might look pale or even bluish, that's cyanosis. And you probably wouldn't be able to feel a pulse in the femoral artery high up on the inner thigh.
And the cat?
They're usually very distressed, vocalizing a lot because of the intense pain from the lack of blood supply.
Can clots go elsewhere?
Less commonly, yes. If they block arteries to the kidneys, gut, or brain, you might see different signs like kidney failure, bloody diarrhea, or neurological problems.
Are there any other, maybe less dramatic signs of HCM?
Sometimes fainting, syncope can happen. It can look a bit like a seizure sometimes. And sadly, though it's relatively rare, sudden death can sometimes be the first sign.
Wow. And what might a vet pick up during an exam? You hear about heart murmurs.
A vet might hear a murmur, yes. Often a systolic murmur, heard best over the left side of the chest. But, and this is really important, up to a third of cats with HCM don't have a murmur.
So no murmur doesn't mean no HCM?
Absolutely not. The vet might also hear a gallop sound, an extra heart sound, like an S3 or S4 gallop. These suggest the heart isn't filling properly.
Okay, what else?
They might detect an arrhythmia, an irregular rhythm, or the heart rate could be too fast or too slow. Sometimes the heart sounds just seem muffled or quieter than expected.
And checking the pulse is important too.
Definitely. The pulse quality can change. It might feel weak or bounding or irregular. And as we said, with ATE, the femoral pulses might be absent. They might also see jugular vein distension in the neck.
So that physical exam sounds really crucial as a starting point.
It is. Careful observation, listening closely to the heart and lungs, checking pulses, mucous membrane color. It all builds the picture.
If the exam suggests HCM, what's next? Blood pressure.
Yes, measuring blood pressure is standard. Often it's normal in primary HCM. But sometimes high blood pressure causes similar heart changes, so we need to check. And in severe CHF or ATE, the pressure might actually be low.
What about an ECG, the heart tracing?
An ECG looks at the electrical activity. It can be abnormal in, say, 35 to 70% of HCM cats, but the findings aren't always specific just to HCM.
And what kind of things might it show?
Things like shifts in the electrical axis, conduction blocks, changes suggesting chamber enlargement, arrhythmias, often ventricular ones. But a quick ECG might be normal.
So you might need longer monitoring.
Sometimes, yes. A Holter monitor that records for 24 hours can catch intermittent arrhythmias that a snapshot ECG might miss.
Okay, so ECG gives clues but isn't the final answer. How about chest x-rays?
Thoracic radiographs, yeah. They're very useful. In mild HCM, they might look normal, but often you'll see signs the heart is enlarged. It might look elongated, or the bottom tip, the apex, might shift towards the middle. Left atrial enlargement can give the heart that characteristic Valentine shape on certain views.
And x-rays show fluid too, right, for CHF?
Yes, they're crucial for spotting pulmonary edema or pleural effusion. We can also assess the pulmonary vessels, and vets can measure the vertebral heart size, the VHS. This compares heart size to the vertebrae. Normal is around 7.5. Over 8 suggests heart disease. Over 9.3 is highly suggestive. But again, a normal VHS doesn't rule HCM out completely.
Understood. What role do blood tests play?
Mainly ruling out other things, like checking thyroid levels, T4 in older cats, because hyperthyroidism can mimic HCM. Routine blood work might show anemia, which can cause a murmur itself.
Are there specific heart markers?
Yes, cardiac biomarkers. N2-proBNP often goes up with more severe disease, especially CHF. And cardiac troponin I or CTNI can also be elevated, indicating heart muscle damage.
Okay, which brings us to echocardiography. The heart ultrasound, you mentioned this is key.
It really is the gold standard for diagnosis. It lets us see the heart muscle directly.
So you can actually see the thickened walls.
Exactly. We measure the left ventricular wall thickness, look at the papillary muscles. It confirms HCM and helps rule out other causes of thickening, like hypertension.
What else can you see on an echo?
We measure all the chamber sizes. The left atrium is often enlarged, and we quantify that with the LA-AO ratio. A bigger LA means higher risk for clots.
And heart function.
Yes, we assess both systolic function, how well it pumps, and diastolic function, how well it relaxes and fills, which is often the main problem in HCM.
Can it show other specific HCM features?
Definitely. We look for something called samsystolic anterior motion of the mitral valve, which can obstruct blood flow out of the heart. We can see mitral regurgitation or leakage. We can sometimes see smoke-like echoes in the left atrium called spontaneous echo contrast, or even actual thrombus clots.
So it gives a really detailed picture. Is 2D echo the standard?
Yes. 2D is preferred over older M-mode techniques to make sure we see the whole ventricle, as thickening can sometimes be localized. We take lots of measurements over several heartbeats, and follow-up echoes are vital for monitoring progression and treatment.
I saw MRI mentioned somewhere too.
MRI can give amazing images, perhaps technically the most accurate, but echo is far more practical, available, and usually doesn't need anesthesia, so it remains the go-to diagnostic tool.
And lastly, if a cat passes away suddenly.
A necropsy, a post-mortem exam, can provide a definitive diagnosis. It will show the typical gross changes, thick left ventricle, dilated left atrium, and the microscopic changes like myofiber disarray and fibrosis.
That gives a very clear picture of the diagnostic process. Let's talk treatment. You said there's no cure.
That's correct. No cure currently. So, treatment is all about managing the disease.
What are the main goals then?
Primarily to control any signs the cat is showing, prevent or delay complications like CHF and ATE, try to reduce the risk of sudden death, and overall just maintain the best possible quality of life for the cat.
What if a cat is diagnosed but has no symptoms? Do they need medicine right away?
Generally, no. If the cat is asymptomatic and the left atrium is normal or only mildly enlarged with good function, routine medication isn't usually started.
So what do you do for those cats?
Close monitoring is key. Regular checkups, maybe every 2 to 4 months. Listening to the heart, checking blood pressure, maybe repeating an echo periodically depending on the case and breed risk. Catching changes early is the goal.
Okay. But for cats that do have signs or are at higher risk, what medications are used? Let's start with beta blockers, like Atenolol.
Right. Atenolol is often used, especially if there's moderate to severe HCM and that outflow tract obstruction, the SAM we talked about.
How does it help?
It slows the heart rate, which can reduce the obstruction, lessen murmur intensity, decrease the heart's oxygen demands, and give the heart more time to fill between beats. We adjust the dose carefully to get the heart rate in a target range, usually 120-160 BPM.
Other times you wouldn't use it.
Definitely. It's generally contraindicated if the cat has low blood pressure, a very slow heart rate already, active AEE, or is in congestive heart failure, though sometimes it's very cautiously added back in stable CHF if there's significant obstruction. It might also potentially worsen left atrial function if that chamber is already severely diseased.
Okay. What about another class? Calcium channel blockers, like diltiazem.
Diltiazem can also slow the heart rate, and importantly, it can help the heart muscle relax better during diastole, which is a key problem in HCM. It might be an option, particularly if there's LA enlargement, but not significant outflow obstruction.
Any downsides compared to Atenolol?
It can have a slightly higher risk of side effects like poor appetite, weight loss, or sometimes skin issues. There's a long-acting version used sometimes, especially for controlling rate in atrial fibrillation.
And ACE inhibitors.
Gallop.
Benazepril.
They might be considered if there's significant LV thickening and the left atrium is moderately enlarged, say over 20 millimeter diameter on echo. They're also commonly used as part of CHF management to reduce the workload on the heart and help manage fluid.
Now, preventing those dangerous clots, ATE, what's used?
Anti-platelet drugs are really important here. Clopidogrel is generally the first choice, especially with moderate to severe LA enlargement or signs of poor blood flow in the atrium like spontaneous echo contrast.
Is aspirin an option?
It's considered less effective than clopidogrel, but it's sometimes used maybe as an alternative or even in combination for very high-risk cats.
High-risk meaning?
Very large LA that smoke in the atrium on echo, or if they've already had an AE event. Combining clopidogrel with low-dose aspirin or maybe using low molecular weight heparin might be considered in those cases, but you have to watch carefully for stomach issues.
Okay, let's shift to managing congestive heart failure. CHF, what's the main treatment there?
Diuretics. Furosemide is the absolute cornerstone. It helps pull that excess fluid out of the lungs or chest cavity, making breathing easier.
How's it given?
It can be given by injection in emergencies or as tablets or liquid orally at home, sometimes even subcutaneously. The dose is adjusted based on the cat's breathing rate and effort. The aim is the lowest effective dose to minimize risks like dehydration or low potassium.
Is anything else used in acute CHF?
Sometimes a topical nitroglycerin paste is applied to the skin for the first day or two. It helps relax blood vessels and reduce pressure backing up into the lungs.
What about pimobendan? I hear that used a lot in dog heart failure.
Pimobendan helps the heart contract better and dilates blood vessels. Its role in typical HCM is a bit more debated. It's not usually a first-line drug for HCM unless CHF is getting worse despite diuretics and ACE inhibitors, or if the heart failure is due to a different type of cardiomyopathy where systolic function is the main issue, provided there's no significant outflow tract obstruction. It can be given IV in the hospital in critical cases.
Any other common CHF meds?
Spironolactone is often added. It's a weaker potassium-sparing diuretic, but might also have some beneficial effects on the heart muscle itself. We also sometimes need antiarrhythmics if there are significant rhythm disturbances affecting the cat. And taurine, of course, if it's taurine-deficient DCM, though that's rarer now.
Beyond the drugs, what supportive care is crucial?
Oh, absolutely vital. Oxygen therapy for any cat struggling to breathe. If there's significant pleural effusion, tapping the chest thoracentesis to remove fluid can be life-saving.
And managing stress.
Hugely important. Sedatives like budorphanol might be used carefully in distressed cats to reduce anxiety. A quiet, calm environment helps. Easy access to food, water, litter box.
What about pain relief, especially for AT?
Pain relief is paramount for AE. Strong opioids like fentanyl or buprenorphine are needed initially. Gentle warming can help too.
Fluids, are they given?
Usually avoided or used very cautiously in CHF because you don't want to add more fluid volume. Maybe at very slow rates if there's severe dehydration or kidney issues secondary to poor perfusion, but with constant monitoring. Potassium supplementation might be needed if diuretics cause levels to drop.
And diet.
A good quality, palatable diet is important, especially as appetite can wane with CHF. Sometimes lower sodium is recommended, omega-3s maybe, always guided by the vet.
Managing ATE long-term sounds tough.
It is. It requires intensive hospital care, initially pain control, anticoagulants like heparin. Clot-busting drugs have risks and aren't always used. After discharge, it's lifelong Clopidogrel, protecting the limb, physiotherapy once stable. But the prognosis, it's often guarded to poor, sadly. Recurrence is common.
And what if the heart failure just keeps progressing despite treatment?
Yeah.
Refractory CHF.
That's stage D, yeah. When they remain breathless despite maximum tolerated diuretic doses, management might involve increasing diuretic frequency, maybe adding spironolactone if not already on it, potentially repeated thoracocentesis. It's very difficult, and the prognosis at that stage is poor.
This has been incredibly informative, a lot to take in. Could you maybe recap the main points about HCM?
Sure. So HCM is common in cats, often silent early on. Signs when they occur, very subtle lethargy, breathing issues, or severe events like AD. Diagnosis relies on a good exam, ruling out other causes with blood tests and T4, using x-rays, but echocardiography is really the key to confirm it and assess severity.
And treatment.
No cure, so it's about management. Monitoring asymptomatic cats. For others, medications like beta blockers, potentially calcium channel blockers, ACE inhibitors, definitely anti-platelets like Clopidogrel for high-risk cats. Diuretics are essential for CHF. Plus, crucial supportive care, oxygen, stress reduction, pain relief when needed.
And it really underscores that this is complex, progressive, and outcomes vary a lot between cats.
Absolutely, which is why regular vet visits are so critical for catching it early or monitoring it if diagnosed.
And just to reiterate for everyone listening, this discussion is for educational insights, absolutely not a replacement for professional veterinary advice. Please, always consult your certified veterinarian with any concerns about your cat's health.
Definitely. We hope this deep dive helps you understand HCM better, and maybe it leaves you with a question to consider. Knowing how common and sneaky this condition can be, what proactive steps or conversations can you initiate with your vet to best look after your own cat's heart health long term?